get up.
And anybody else that would like to speak, we have an empty chair if you'd like to come on board. Good morning.
Good morning, Senator Mills, Vice Chairwoman Regina Barrow, and members of the Senate Health and Welfare Committee. My name is Frankie Robertson, and I am here today representing March of Dimes, a national and international leader, trusted leader in maternal and infant health care. I'm also here representing one of my clients today, which is Centering Healthcare Institute. It is also a global leader in centering in maternal child health care. For those of you who may not be aware or familiar with Centering Healthcare Institute, as you may be aware of the name of March of Dimes, is Centering Healthcare Institute offers a model of prenatal care called Centering Pregnancy, which we implement here in multiple sites here in the state of Louisiana. And that program is designed to provide necessary prenatal support for women throughout their prenatal period by way of a group model of care, which can provide support to people in the gestational period. If you can give me a moment, just pull up my notes here. I would like to share with you today why March of Dimes is in opposition to this particular piece of legislation.
And I guess just to be clear, with the amendment, you're still in opposition?
Yes, sir,
Okay.
we are.
Okay.
We would appreciate the opportunity to have a conversation with Senator Cathey to support him in his efforts to provide the necessary supports to birthing people or new mothers who are impacted by the disease of substance use disorder. We are not opposing his desire to help mothers, but what we unanimously say is this is not the way to do that. And we appreciate his concern in recognizing that our state has a tremendous substance use disorder issue, and we would like to stand with him to support and help moms in their journey. The use or abuse of either illegal or prescription drugs during pregnancy can have serious health consequences for both mother and infant. Neonatal abstinence syndrome refers to cases in which newborns experience drug withdrawal shortly after birth due to drug exposure in utero. In the case of opioids, NAS can result from the use of prescription drugs as legitimately prescribed, from the abuse of prescription drugs, or from the use of illegal opioids like heroin. Pregnant women who are addicted to opioids often do not seek prenatal care until late in pregnancy because they are worried that they will be stigmatized or that their newborn will be taken away. The March of Dimes supports policy interventions that will enable women to access services supports policy interventions that will enable women to access services in order to promote a healthy pregnancy and build a healthy family. The March of Dimes supports policy initiatives aimed at providing care for mother and baby. Number one, access to comprehensive services. Pregnant women who abuse drugs such as opioids should have access to comprehensive services, including prenatal care, drug treatment, and social support services. These women often have other psychosocial risk factors that need to be addressed in order to ensure they successfully stop abusing drugs. Priority access and flexible treatment is number two. Drug treatment programs should be tailored to pregnant or parenting women, taking into account the woman's family obligations, and should provide priority access to pregnant women. Number three, immunity during prenatal visits. Research has shown that by obtaining prenatal care, staying connected to the healthcare system, and being able to speak openly with healthcare providers about drug use creates a healthy environment for mothers at risk of drug abuse to seek treatment that can improve birth outcomes. Provider education. Provider education and public awareness efforts can increase patient-provider discussion on the risks and benefits of various medications, including opioids, and potential risks to the fetus. Additionally, providers should be educated on the most updated substance use screening tools and the standard of care of all obstetrics patients. The March of Dimes opposes policies and programs that impose punitive measures on pregnant women who use or abuse drugs. In some states, policymakers have proposed punitive measures for women whose infants experience NAS. The March of Dimes believes that targeting women who used or abused drugs during pregnancy for criminal prosecution or forced treatment is inappropriate and will drive women away from treatment, vital for both them and the child. And then I'd like to speak specifically to some of the concerns about Senate Bill 60 in particular, and not just in theory. Many states have reported increases in the use and abuse of certain drugs, including prescription opioids. For women who are pregnant or may become pregnant, drug use or abuse can have serious health consequences for their newborn. Policymakers who wish to address these issues must focus on solutions that improve the health of both mother and baby. Pregnant women may not be aware of the potential harm to their baby from prescription opioids. Ensuring access to proper and comprehensive prenatal care is vital to the health of all moms and babies. The use of punitive policies has not been shown to be effective in reducing the incidence of substance abuse. Senate Bill 60 will have detrimental effects on pregnancy outcomes and perinatal health by undermining current efforts to implement evidence-based care. For example, Senate Bill 60 could increase maternal mortality and morbidity in Louisiana related to substance use by driving patients away from life-saving behavioral or substance abuse care. I want to share, as we've shared before, that overdose is the leading cause of pregnancy-associated but not related death in Louisiana, according to the Pregnancy Mortality Review Board report, also known as the PAMA report. Patients affected by substance use disorder frequently face stigma and bias, which can affect the quality of their care. Universal toxicology testing may inadvertently bias some providers against engaging with patients in collaborative and respectful ways. And looking at the amendment, we certainly appreciate the efforts to make some sort of amendment, but by removing shall to may, that also reiterates the statement that I just made about potential bias, whether it's intended or unintended. So that does not take away all of the concerns that we have in the bill. In some fashion, it sort of increases it because there's not a linear effect to everyone being tested. Doctors can choose now who they choose to test and what consequences then occur to that particular birthing person. In closing, I'll say that there are other interventions recommended over toxicology testing that do a better job of assessing past and or lawful use and do not undermine patient-provider relationships. ASAM and ACOG both recommend universal screening using a validated questionnaire as a means of assessing past and present substance abuse, as well as potentially identifying risk factors for future use. Screening using a validated tool takes little time and can be accomplished during multiple points of care. Following a positive screen, a brief intervention and referral for treatment is required, which, unlike Senate Bill 60, actually connects patients to care without additional trauma. At the same time, a provider is screening for substance use or misuse. They can also screen for things like intimate partner violence, which is also one of the increased causes of death identified in our Pregnancy Mortality Review report. Lastly, we ask that you join us in addressing our concerns about Senate Bill 60 and work together collaboratively to truly identify things that will help moms. I personally believe that Senator Cathey's heart is in the right place, but the research will tell you that this is not the answer, and because of that reason, we ask that you oppose this bill.
Thank you so much, and thank you for your work with March of Dimes. You stay in touch with a lot of us with committee on a lot of issues, so thank you very much for your work. Ms. Schilling?
Yes, good morning. My name is Ellie Schilling. I'm a Louisiana attorney who represents reproductive health care providers and other health care providers. And I'd like to start by addressing the amendment and some of the legal problems that I think still exist in the bill. Specifically, then, I think there's a lot of Fourth Amendment problems here, particularly in the context of public hospitals. Even though the bill would not now require mandatory blood testing, it is allowing that testing to be done without consent and without probable cause. So taking someone's blood is a search, like by definition, under the Fourth Amendment, and it could be done, if this were the law, without any patient consent and without any probable cause. So that's a significant Fourth Amendment problem. There's also some potential other equal protection problems in terms of that this is only going to obviously be used with women and pregnant people. That's the sort of the baseline for what screening is. There's no suggestion that, fathers should maybe be screened for potential, drug use and maybe parenting problems that they might have when they're at the hospital. And then just to sort of reiterate, even with the discretion now, then that inserts a whole other host of problems in terms of how, as Senator Barrow already asked, how is this going to be determined? How are physicians going to decide when they do and do not, take somebody's blood without their consent? So that's going to lead to discriminatory enforcement and bias. And the parts of the bill that are most concerning are the criminalization aspects of it, and the parts that allow for referrals to Child Protective Services. Nothing in the bill says that these results are prohibited from being sent to Child Protective Services or cannot be used against somebody in criminalization. So if those parts of the bill were taken out, it would improve the bill quite a bit. But the way it is now, all of those risks are still there. And then compounding that, you have other